Well, good morning, everyone. I'm Pat Courneya. I am a family physician, and I work as the Chief Medical Officer for Kaiser Permanente. And my responsibilities include making sure that we're delivering the kind of high-quality, high-service care that we know that our members expect. And actually, I've had a relationship with many of the people who have been a part of this work. In fact, David and I worked together at Health Partners for about 13 years while I was an employee at Health Partners. I have known George Isham, who was on yesterday as a plenary speaker, for many years. He's been a very important mentor, teacher of mine. And in fact, David was at Kaiser Permanente and came to Health Partners, so the connections are very strong and important to me. So I'm really delighted to have been invited to come here and say a few words. As I prepared for this and learned a little bit more, I was struck by a few things that came forward to me. First of all, this isn't the first time where dental community and the medical community have come together in partnership to engage in a large national debate. There was one really big example where actually ultimately in that partnership, based on the goals they had at the time, the American Dental Association came out the winner and the American Medical Association came out the loser. And that was actually in 1965 when Medicare was first created, and the American Medical Association and the American Dental Association partnered to try to get rid of that and prevent it from becoming law. And the American Medical Association was battling against Medicare. Medicare came into being, and it included medical care and excluded dental care. And so ironically, back in that time, the goals were completely different, and the results were unexpected. And so the fact that we've seen this transition and these changes over these last few decades is pretty exciting to see. There's another thing that I think is really interesting. We've had a lot of really good conversation, people making presentations, speaking very important concepts. They've constructed those concepts by seeing what was going on and what was wrong, by listening to others and understanding how to do that, and using their minds to actually construct new solutions. The irony that I think comes forward in that to me is that, as Bernard Tyson, our CEO, is so fond of saying, it's time for us to reconnect the head to the body when it comes to mental health, when it comes to vision care, when it comes to hearing and oral health. Ironically, those were the organ systems that seemed to get the short shrift when it came to any of these issues of public policy and coverage and availability of care and health. So I thought it was really kind of interesting that all of those areas actually are areas of opportunity, and we have seen in the last decade or so with the rise of mental health parity some really significant changes, advances, and challenges that may serve as potential lessons for us in this conversation going forward. The other point that I would like to make, and it relates to the comment that David made before, the lion's share of this conversation related to making the case for including oral health in the Medicare benefits has been relative to the impact that it can have on the traditionally covered conditions, the impact that it can have on delivery of preventive services, the impact and correlation that it has on maternal health, cardiovascular health, et cetera, et cetera. And that's important. As Eric said, it's critical to make real and important to the politicians, the things that happen as a consequence of good oral health to their constituents. But the sooner and the more effectively and the more aggressively that the dental community can measure the value of what it does, the more the arguments stand not just on the fact that there's that connection to those other important priorities, but that the value of good oral health is intrinsically important and stands on its own. And so I think that that's a really important concept to take into consideration. I want to start the next part of my conversation with a patient story. It's a real patient. It's a young girl who was seen in one of our dental clinics. And as a part of the routine work done in that medical dental integration, her blood pressure was taken and it was seen to be really remarkably high, surprisingly high, so much so that people kind of assumed that there was an error made in gathering that information. It was a good 10 months before she was due for her next well-child visit. And as all of us know, 10 months can go to 12 months, can go to 24 months. It turned out that she had a condition called vesicoureteral reflux, which allowed urine in the bladder to wash back up towards the kidneys, put them under pressure, cause renal failure, and ultimately cause the kind of blood pressure problem that she had. Now, in that case, the dental connection to the medical group made it possible for them to draw in and get in a consultation in the moment with a pediatric nephrologist, to be able to get her in for her visit and to discover that the right kidney had been severely damaged, the left kidney was still doing okay, and that corrective surgery that at that point probably made a big difference in the fact that she now has functioning kidneys and can continue to expect the kind of healthy life that she wouldn't have been able to enjoy to the degree she did if she didn't have that interaction and that connection and the certainty of follow-up. Those kinds of opportunities that you see with that medical-dental connection, and given the number of contacts that dentists have with the people that we serve in the healthcare industry, those opportunities are incredible. In fact, one of the statistics that I find most gratifying about the work that we do in the Northwest with our medical-dental integration is that second only to primary care, dentists and our dental clinics close more care gaps than any other part of the organization in the Northwest. And when you think about the impact that that has on long-term health and well-being, it's really pretty incredible. So it's a powerful, powerful connection, and it's one that we need to make sure is strengthened. We're fond of thinking at Kaiser Permanente that everybody understands and knows who we are and what we are, and we know that that's not the case. So just a couple of words about the organization. We've been around nearly 75 years. In fact, our 75th anniversary will be in 2020. And we have combined coverage and care during that entire time. And we have our health plan, we have a hospital system, we have a dental group deeply integrated into the organization in our Northwest region, and they've been there for 45 years. And we also have medical groups in each of our regions that provide the care in a mutually exclusive relationship between the health plan and hospital system and the medical groups. That combination of healthcare finance and healthcare delivery, and in the case of the Northwest, dental care, is a really powerful combination, we feel. It's not unique. There are other organizations around the country that do that, but we're larger than any of the others, and we've got a lot of experience, and we actually bring together assets that are different combinations in each of our regions to do that. In our California regions, for instance, we have really basically all of the system, the hospitals, the clinics, the physicians, the nurses, research, all of that. In our other regions, we have varying combinations of that, more or less of the hospital care, et cetera, et cetera. So we bring together other combinations to get our work done. Some raw statistics, about $80 billion a year in revenue, 12.5 million members now, a little over 200,000 employees, 22,000 physicians, 39 hospitals, a lot of office buildings, a lot of research going on. So a good-sized organization. Interesting geography. We now are kind of occupying the entire West Coast, but we have Colorado in the middle of the country, the mid-Atlantic states. We have Georgia, especially in the Atlanta metro area, and then Hawaii is where our regions are. And that just gives you a sense of the organization itself. Now, I want to talk a little bit about medical dental integration. As I said before, KP Dental has operated in the Northwest for 45 years, opening in 1974, and they have in the membership of the plan nearly 300,000 members. They extend primary care. We have the configurations being different based on history, based on the pilots that we heard about before, and they go all the way from Tier 1, where it's a freestanding dental clinic, all the way to a much deeper integration at the Tier 4 level. And I'm going to talk a little bit about some of the things that we see in that sort of natural experiment of medical dental integration that goes all the way from those freestanding clinics to much deeper integration where there's physical proximity and healthcare and dental healthcare professionals working together on teams. So, with regards to overall quality, and I want to bring this up on my slide screen here so that I can actually read it. What this is showing actually is that in the orange bar, which is where we have the deepest level of medical and dental integration, the number of care gaps that are closed is substantially greater than even in our high-performing primary care groups where the dental integration does not exist. The bar length represents the number of months it takes to close a known care gap from the time something is due to the time it's actually given and taken care of. And so shorter bars are better here. And what you can see is that in almost all of these cases, there's a substantial reduction in the time it takes to get those care gaps closed, to get people the care that they need, to get this child the care that they needed to save their kidney function, than in our clinics where we don't have that dental integration. 6,722 interactions that occurred. 40% of those with patients who had not seen a primary care provider in over a year, and 20% in over 2 years. So you can see that these are gaps and these are connections that are happening for many of these people where they might not have happened at all if they relied just on the fact that they might be going into their clinic. With regards to Medicare, similar statistics, closing these gaps, improving quality, getting on top of these chronic medical conditions, and making sure that we've got good control over things like hypertension and diabetes has an impact not just on the health and well-being of those patients, those members, but it also has an impact on the costs for taking care of them and making sure that they stay well and enjoy a longer, healthier life expectancy than they would otherwise. We try very, very hard to be able to articulate the value that we get from that work in financial terms, in clinical terms, in terms that are relevant to the members and the patients that we serve. And in fact, we are working very hard to develop the infrastructure to be able to measure systematically the additional healthy life expectancy that comes from this work. And in this case, seeing the impact that medical dental integration has on our ability to close gaps that we know have an impact on healthy life expectancy, we see this as one of our big opportunities to lay claim to the idea that an organization like ours that takes advantage of the potential of that kind of integration can have a substantial, measurable, and significant impact by taking advantage of the interactions that we have with the members and the patients that we serve. Care gap closure is just another example of how that works. Here, the percentage of care gaps closed in the same month of a PCP visit. And this is kind of interesting. It actually closes faster if a dental visit occurs in the same month that a primary care visit occurs. That reinforcement of another healthcare professional, as that Lindsay's ad showed, from way, way back, that you should listen to what your dentist says, this actually indicates that for those kinds of medical conditions, it actually happens. When the dental team reinforces those messages, we get better performance on getting these care gaps closed. The other thing that we have done, and this has been true actually since 2017, so for a couple of years, we've had the EPIC dental record as a part of the record. So there's a much cleaner, clearer view into the data, view into what's going on the medical side for our dental teams that are doing their work with our patients. David and I were discussing something, an artifact of this that I think is interesting, I'm going to follow up on, that we need to think about. But it's also one that we have to be quite clear about. When measuring performance on blood pressure control, a blood pressure reading that's taken in a dental office, if it's the last one, that's the one that gets counted when it's integrated into the medical record like this. So it just highlights the importance of working to make sure that we get accurate medical records data, and making sure that we are working collaboratively to figure out how to make sure that there isn't an artifact in that measurement approach, but at the same time declare without any ambiguity that the data that we gather in this medical record in our dental clinics is a part of the data that we use to understand the full spectrum and the full understanding of what the well-being is of our patients. And it's a valuable, important, and critical part of that. So it must continue regardless. Okay, so I've shared a few of the things that we see as clear indicators of the value that we get in our Northwest region from that medical-dental integration. Really excited to hear what your questions are, because that's actually where we can connect to what's important to you as opposed to what we've guessed might be important to you when we put together our remarks. So look forward to your questions. Thank you for the opportunity to be here, and look forward to seeing how this whole agenda, this coalition, this paradox drives change in the country. So thanks for the opportunity, and look forward to your questions.